Hi, everybody. This is Klaus Ehlers. This is Klaus in 60 Seconds live on Facebook. We meet every Friday, have a fantastic conversation with an interesting person or people. We did two people last week on the intersection between what they're doing and what Family Promise is doing. Of course, Family Promise is the leading national organization addressing family homelessness. And today's guest is it's a really tight intersection. I first met Mark Johnston in 2011 at our national conference in Salt Lake City. At that time, Mark was the person at HUD who was responsible for special populations, which included people experiencing homelessness. And we've stayed in touch over the years. Mark actually attended and presented at our conference in San Antonio a couple of years ago. I am thrilled to have him on. This is one of the true experts in our field. And we're going to be talking about the changing response to homelessness and sort of his observations after a very long career, which is still ongoing. So I'm going to welcome Mark on and we'll get started.
Great. Thank you very much, Klaus. It's a pleasure to be here today.
It's great to have you, Mark. So as I said, right, the tagline for this was the changing nature of the response to homelessness. And probably it makes sense to start at the beginning and talk a little bit about the roots of homelessness, particularly family homelessness, and your perspectives on that.
Sure. I think that is useful to understand what some of the foundational reasons for homelessness is in this country. And, from my perspective, and I've worked on it now for almost 40 years, urban renewal was one of the first significant reasons that we were going to have a problem in terms of having homelessness. Back in the 50s to 70s, Congress was trying to improve blighted cities. And so they provided funding to cities to tear down areas that were what they considered to be blighted, and then create more decent and affordable housing. And unfortunately, while these leaders tore down these typically neighborhoods, they often decided to do something else with it. So first of all, they were tearing down neighborhoods, but they were often where people of color were living. They tore down all sorts of old hotels, which eliminated about 1 million units of housing. And they decided to a large extent not to replace all this destroyed property with new, affordable, family-friendly housing. So in New York City, a large blighted area was replaced with Central Park. In Pittsburgh and other cities, it was sports arenas. In DC, they tore down a lot of housing of families and replaced it with where I used to work. That's the Department of Housing and Urban Development in downtown Washington, D.C.
A lovely building that is.
Yes, it's something to behold. And so the sad thing is, despite their apparently earnest efforts to create more affordable housing in many of the cities across the country, there was net loss of housing. And then that was coupled with the closing down of state mental hospitals across the country, where there were a net loss of over 400,000 beds, and really nowhere for people who were severely mentally ill who couldn't be taken care of at home to go. There had been a plan to create community mental health centers that really didn't get funded very well. And then the tipping point occurred in the early 1980s during the Reagan administration, when the economy was doing pretty poorly. The unemployment rate reached about 11%. So lots of families were unemployed. Then there were cuts to the welfare programs for families. And then there was a shift away from supporting public housing to trying a new model, which we now know to be Section 8, providing rental assistance, which is a fine thing, except it wasn't creating any new units. So you'd have very large public housing projects around the country being torn down, and often the places that these folks needed to go was a Section 8, but there was no new housing being developed. So all of these things together started making it a very visible problem in this country. I moved to DC to begin work in 1983, and I was assigned to be a researcher at the White House for a Presidential Commission on Hunger. And we added a section on homelessness because we started seeing it in all these different cities. I remember one day, and this was a 7-day-a-week job for a few months, we're writing this report to the president. And so I took a break and I walked outside the White House grounds, and I saw 4 guys sleeping on a heating grate. And I just couldn't believe it. People are sleeping outside. It was a new thing. And so I went up to them and asked them, what's going on? I heard that there was some kind of a homeless shelter being opened up, and why weren't they there? And they said, we wouldn't dare go there. It's really dangerous. They have guns, they have lights, they have everything in there. And that was my first exposure to this issue that started ballooning. It was later that year in 1983 that the federal government created its first homeless program. And because they thought it was a temporary problem, they put it in FEMA. They thought it was an actual short-term disaster. And that's where the Emergency Food and Shelter Program came from, was that early thinking that that would be the solution to homelessness. And then by 1987, the federal government realized that homelessness is not going away anytime soon. So let's create some homeless programs and let them run for 5 years, and then it will be over. So that's sort of the genesis of how we got to where we are today, with lots of people living on the streets and even more people living in shelters, including homeless families.
Yep. And right, two points to make off of that. One is we started in 1986 because, again, family homelessness was this relatively unknown phenomenon. You certainly had poverty, you had displacement, but you just did not have family homelessness until the 1980s. In any kind of significant way until the 1980s. So we started in 1986, and again, it was like, we've got this problem. Let's figure out some way to solve it. Not let's create a national organization to address a core challenge that this nation, unfortunately, has held now for 4 decades. So you started working in the White House. You started working at USICH and HUD in 1987. You started working kind of officially with a portfolio in homelessness. So, like that's the starting point, right? So you have 4 decades. What have you learned? What can you teach us?
I've made a lot of mistakes, and the government has too. That's the first thing I'll readily acknowledge. And as I reflected, because Klaus shared with me the questions that might be asked, so I could kind of think about what might be some interesting things to discuss. And I really have, in large part, learned through mistakes, but learned a lot of different things. I wanted to highlight 5 quite briefly. One is addressing homelessness has got to be replaced with ending homelessness. And we hear a lot more about that now. It had been for the first 15 years of my career, the word ending had never been discussed. And it's kind of amazing when you look at what's been happening that really homelessness can be reduced and honestly can be ended. So recently I looked at every imaginable social problem. So suicide, drug abuse, crime, obesity, poverty, child abuse, etc. And almost every social problem is regularly increasing, and most of them were increasing on an annual basis. So suicide, which I looked at yesterday, has increased 9 in the last 10 years. The sole social problem that has been on the decline, when you look, for instance, between about 2010 to now, is homelessness. And I'm not saying it always goes down, and within some populations it goes up a little bit, but there's no other social problem like it, because we've had this very explicit, specific, targeted focus on it. And it can be declining, and it has typically been declining, and it really could be ended as well at the city level. So that's number one. The second lesson would be that I visited, when I was at HUD, a lot of projects around the country. So if I were asked to speak in a city, I would go there a day or two early, visit some local HUD-funded projects, talk with folks who were there to really understand what they were trying to do. And I was amazed at how many times I realized, wow, I'd never seen that before, or I now understand why our homeless program doesn't work as well as it should. Would go back to the office, and others in my office would do the same thing, so we could start tweaking, adjusting, or frankly, just changing our programs to make them better. And related to that, in terms of seeing projects locally, I also found it very valuable to look at data, including at the national level, to appreciate it. So I'll give one example that had a big impact, and that was, I got a call one day from a friend of mine, Dennis Culhane, a researcher from University of Pennsylvania. And he said, Mark, I've seen some fantastic data in New York City and Philadelphia by looking at individual homeless cases of every single person who was homeless in those cities. And what he found was that about 15% of people who were homeless for a long time and consuming lots of different resources. So we found, for instance, when we dug into Seattle, that there was an $80,000 per year cost to have a person or a family live on the streets of Seattle because they were going to various institutions like hospitals and detoxes, et cetera. So you're wasting $80,000 a year when you could have been housing that individual or family for only $24,000, and that included the services. So that was a big aha moment that the homeless population is not monolithic. There are very different subgroups in there that we need to think about in a much more intelligent way. The third lesson learned for me was collaboration. And I know it sounds like, yeah, you just got to say that, but I truly, truly believe it. And I'll give just a couple of quick examples. Initially at HUD, we had a bunch of different programs. We had the supportive housing program, the shelter plus care program, the Section 8 SRO program, and some others. And by law, every one of these programs ran separately. So everybody in the country would apply for each of those programs. And because of that, there was no collaboration really at the local level to talk with each other as agencies or even cities and counties and nonprofits. So that's why we shifted and made this thing called the continuum of care, where there'd be one application from a community so people actually would talk and communicate and prioritize what they considered to be the most important projects. And I know there are some challenges to that, but I think overall we've had massive gains on collaboration at the local level that we had not seen previously to that. One other example I want to give, and it's something to think about in terms of family homelessness, and that is something we learned with our partnership with the VA, which is the best collaboration at the federal level that HUD has ever had. One day, this was years ago, I got a call from the VA saying, we'd like to come over and talk to you all about an idea. And we didn't know what it was going to be. So we sat around this coffee table. There were like 3 people from VA and 4 of us from HUD. And they said, we've got a lot of great services. We've got drug treatment, mental health treatment, counseling. They went on and on with all their healthcare services also, but we don't have any housing. And so we can't really solve their problem because their basic problem is housing. So we started noodling on what we should do about that and came up with the idea of HUD VASH, went to the Congress. They said, let's do that, where VA uses their strength, which is services and healthcare, and HUD has expertise in housing. So that started this collaboration between HUD and VA, and we've just continued it on a very regular basis. So for instance, when HPRP, the Homeless Prevention Rapid Rehousing Program, was funded for HUD, at the end of it, we made a lot of mistakes in running that program. Partly it was just the way it was designed to use ESG, et cetera. So I called the VA and said, look, we made some mistakes, but we also found some pretty cool successes. As you're building out your brand new SSVF, please learn from our mistakes and our good lessons learned. And as a result, SSVF is a very great program. So I really think there's potential, and I'm going to get into that in just a minute, where there can be some wonderful collaboration at the federal level between HUD and an agency that's really dedicated to homeless families, where we could make more progress. The fourth lesson learned would be that to be building better mousetraps. That's kind of the theme of this discussion today. And that is, we initially thought in the world of homelessness that you needed 3 things. You needed emergency shelter, then transition them to transitional housing, then give them some permanent housing. And over time, we've realized that there are other needed interventions, such as a very targeted prevention program. I mean, why have somebody become homeless if you have a pretty good sense about who might become homeless and you could prevent that? It's so much better for the children who are going to be dislodged from their neighborhood, from their schools, et cetera. Diversion programs. So if families are presenting at a shelter, to be able to divert them then, rather than have them enter into a homeless shelter system, is so much more ideal. Rapid rehousing, which is largely a program for homeless families, is another intervention that we have seen over time is a wonderful use of limited resources. And I have no doubt over time, we're going to continue as a collective, identify additional improvements, additional interventions that are going to make it much better for reducing and ending homelessness. And the last lesson learned for me, and there are many to be honest, but would be that housing first actually really works. It took a long time for HUD to acknowledge that. It took me a while. Many providers initially were pushing back on it when it was first introduced. When I was at HUD, the secretary that I was working for, the assistant secretary, and the deputy assistant secretary, those are my 3 bosses, all were vehemently opposed to housing first. So I resolved we ought to do a study to actually see objectively if it works or not. And so got some funding from Congress, ran a national study, and found a success rate of about 83%. That is 83% of people after a year were still housed if they could get the services to keep them housed. So while that administration didn't allow me to release the report, I just waited for the next administration. We did release it. And I really think a huge impact on reducing homelessness ever since then has been the concept of truly embracing housing first.
All right, that was a wonderful categorical list there. I'm gonna touch on a couple points that you made there, because
Okay.
I agree with some of what you say. I don't agree with everything that you say. I do think
Sure.
when we look at the family space, we've seen child homelessness increase, considerably, using DOE measures, using other departmental measures. And that's always one of the challenges we have, is between the HUD and the DOE and HHS definitions and so on.
Yep.
And I think your point about collaboration, though, I want to lean in that, because I think that's terrific. And what we've been pushing for is more collaboration with ACF, right?
Yes.
Because Frisbee childcare, Head Start, all of these interface with families at risk of experiencing homelessness in many ways much more than HUD does, and bringing that together. So I love what you're talking about there. Certainly prevention and diversion are things we've seen in the past year, a doubling the number of affiliates that are doing prevention and diversion. Prevention programs, diversion we really think of as a practice, not a program.
Yes.
Right? It's a better way to frame it. We've seen our affiliates double in the use of that, which is, I think, so critically important. And I think, you touched also on the point of limited resources. And I'm going to, I'll stick a pin in that, because I know you want me to do the questions in order, because I think that
No, I'm fine. If we want to jump into the ACF conversation, I'm fine with that.
Well, I actually want to jump into the limited resources conversation, because I really want to get your insight on this. We look at the American Rescue Plan. We look at the Jobs Act, the American Family Plan. I mean, these are there's some incredible things happening, including really this focus on the creation of affordable housing, because that's what we see, right? It's not about upskilling. It's not about health. I mean, these things all matter. Childcare, they all matter, but it's the lack of affordable housing. So we're entering a phase where we are getting the resources that we always wanted to have. So what do you think about the current proposals, the current legislation, and what impact do you think they will have, and how do we maximize that impact?
Yeah. Great question. For years, when I've thought about trying to having a mission in this country about ending poverty or ending child poverty, I always felt like it just wasn't taken very seriously. That, President Johnson announced it in '64 that he was never going to relent. We were going to end poverty in America. So there were a lot of programs created, but I never saw any real plan to do it. And so I was doing a little research recently on child poverty, and I was kind of stunned to look. I was looking between 1990 and the most recent year, which was 2018. And in 8 of the last 9 years for which we have data, there has been a very consistent and large decline in child poverty. I mean, it's amazing to think 8 out of 9 years, there's been a decline from 22% of all children to 14%. And so when I was listening to the president speak this week to the Congress, and I heard all of these proposals, it was mind-blowing just to think about the size of these proposals and the impact it could have. So I sincerely believe if those things actually got enacted, there would be a real chance to see even a much more dramatic decline in child poverty than we've seen in the last 10 years. And then when I hone in on the notion of homelessness, which is, very small. So there's around 30 million poor people in America. There's around 500,000 people who are homeless. So it's a very small subset of those who are poor. It was interesting. I looked at a couple of different programs and I think it's useful to have perspective here that normally, like when I was at HUD running the homeless programs, ESG was, like a $200 million, $300 million program. Typically, it's recently been around $290 million. With the CARES Act, it's not twice as much as that or 3 times as much that, it's 14 times that size. It's over $4 billion. And most all of my work in the last year has been working on using ESG for COVID purposes on diversion, prevention, rapid rehousing. So I really think there will be a very large impact for especially families with this ESG CV money that, it's so much bigger than we've ever seen before. So that's one thought. And the other, even more related to what you're asking about in terms of homeless housing for people, is the large funding in the other part of HUD. It's actually just down the hallway, the home program, which normally is funded at $1 billion. And for 2021, that office received over $6 billion. They have never seen money like that. And almost all of it is targeted for people who are homeless or at risk of homelessness. So there's no detail yet from that office in terms of how it's actually going to run. They've never run a homeless program before. So they're going to be consulting, no doubt, with the HUD SNAP's office. But I think those two programs just combined is, $10 billion alone will have a very significant impact in providing more housing for homeless families than we've ever seen before by far. And another thought I just want to share, and you can just shut me off here, Klaus, but I think it's great that we get this one-time funding like the ESG and the home money. But in terms of making long-term inroads on reducing and ending family homelessness, I do have a couple of thoughts. And I know you may not like to hear it, but I think there's so much to learn from the existing partnership with the VA that could be applied for family homelessness. So this big reduction that we have seen, over the last 10 years, up and down a little bit, but overall it was a 50% reduction in veteran homelessness. I think there's some really important lessons to be learning there. So it was a natural thing for the VA to jump in because they, by law, can only serve veterans, right? There's no federal department that can only serve families. So as I have considered over the years, where those natural federal partners might be on family homelessness, I was reflecting back on just before I left HUD in 2013 and 14, I co-led a federal task force on ending family homelessness. And it was co-chaired by my counterpart at Department of Health and Human Services in ACF and from the U.S. Interagency Council on Homelessness. So, and there was, in terms of families that were living in shelter or on the streets, there was a very significant decline for several years for family homelessness, but it's not been sustained. And so to have a continued progress, like year in and year out, it really is vital to find, I think, a federal agency that could provide the services to be matching up with HUD's housing. And the challenge with HUD is, they have to have, by law, housing for every population. So you don't see a lot of dedicated funding for any population, including veterans, to be quite honest. So, HUD VASH is a dedicated appropriation that the Congress gives. But when you look at the SNAP's office, they do serve all populations. So it's really trying to find a federal agency, perhaps ACF, where there would be true commitment to really emphasize ending family homelessness. So with the VA, they didn't just say, well, we have a role to help families or to help veterans. They created, well, that's HUD VASH. They created SSVF. They went to Congress and hit them up hard for a lot more money. And I think that's the kind of approach, once it's identified which agency to go to, needs to happen in a proactive way. There are 8 different agencies in HHS, like Centers for Medicare and Medicaid, SAMHSA, et cetera. And I do believe ACF is probably the most likely one.
Yeah, and we got that $800 million added in thanks to Manchin and Murkowski from Evento, which is part of what we're looking at. And we're going to try again with HCYA. We're never going to give up on that, Mark. Awesome. Well, any last thoughts before we close out here? This has been fantastic. I really appreciate the engagement we've had with you over the years. I really appreciate you coming on here.
Well, I think we're learning a lot from this last year, both in terms of COVID and racial equity. That is going to change the way we go forward on trying to reduce and end homelessness.
Yeah. Yeah, and it's interesting. We have Amanda Indira is going to be the keynote speaker for our innovation summit coming up, and we're going to be really talking hard about the EIA issues and equity issues, because in essence, if we didn't have structural racism, we wouldn't have homelessness for anybody.
Yes.
It's baked in. Mark, thank you again. I'll wish you and everybody out there a wonderful weekend. And when next time we're going to have an in-person conference, it'll be in Las Vegas, not too far from where you are. So
I'll drive down.
Figure out a way to get you there. That would be awesome.
All right. Take care.
Thank you, Mark.
Bye-bye.
Take care.